When you went into these clinics, what did you say was bothering you? What did you say was your diagnosis?
I said that I had some depression, I had some migraines, and they told me they could treat the conditions in tandem. Basically selling this as a panacea for everything.
Did anybody ask for a referral or any actual diagnosis from a mental health provider? Did anyone have a therapist on staff or
No,
a mental health
not the
provider?
places I visited. In fact, the intake form at one of the places was 2 pages long, and it had some basic questions about my health, and that's it. And I was shocked.
Legalized drug dealing, that's what it feels like based on what you're telling me right now. And look, having said all of that, you even started this conversation off acknowledging that we profiled ketamine in the past where it can indeed help people. So where do you draw the line? Let's dig a little deeper. We want to bring into the conversation Dr. Stephen Mandel, who is the president of the American Society of Ketamine Physicians. He joins us here, and thanks so much for being here. But also join us now, board-certified psychiatrist, Dr. Dominic Sportelli, joining us via Skype from the East Coast. Docs, thank you both for being here, coming at this from different angles. You as a trained anesthesiologist, Dr. Sportelli is a psychiatrist who has spent so much of your career dealing with individuals who are battling mental health issues. What are your thoughts on Leslie's findings during her investigation?
Listen, I want to start off by saying I absolutely support the use of ketamine in treatment-resistant depression. We know that it helps. It's not snake oil. It does work. However, what I'm hearing now is the Wild West of unregulated, non-FDA approved off-label prescribing. What I'm seeing here is coercion, false promises, unregulated claims, no behavioral health intervention, no follow-up, no collaboration. This is absolutely stunning to me, and I'm shocked.
And it feels to me like this is a money grab. Can you briefly talk a little bit about how, okay, ketamine can have a benefit, but what's being charged here and for the conditions in which it's being used? It feels to me that it's less about treating a mental health problem and more about getting someone's money. Is that fair to say in your opinion?
Dr. Travis, that is so fair to say. And you know what? Unfortunately, greed is going to destroy this. And it burns me personally because I know how hard it is to treat treatment-resistant depression. It's unbelievably difficult. This is a fragile population, a vulnerable population, a desperate population. So think about that. You're going to promise them some sort of cure or quick fix. They're vulnerable. They're going to go for it. And let me tell you something. Look. Doctors deserve to be paid for what they do. There is liability, there's responsibility, there's overhead, but anybody that tells you that this is not a lucrative business is straight up lying to you.
Dr. Sportelli, I want to ask you, during my research, there are organizations offering 2-day intensive training courses for any doctor, nurse practitioner, physician's assistant to administer ketamine in a clinic setting. What are your thoughts on that?
Listen, and I've seen it too. Trust me, I get the emails. Come to our weekend clinic and you'll be a ketamine administrator, and you'll get all kinds of money, right? It's a money-making scheme. I am a psychopharmacologist. I'm telling you, there is no magic drug for psychiatry. Now, we know that ketamine has a very high relapse rate. I mean, some of the studies show 70% after a month, everybody's back to their baseline of depression. If you don't treat these people for their life coping skills and ability to deal with their behavioral health disorder, they're going to come right back. But hey, guess what? That works out really well for these ketamine clinics because people are going to keep coming back because they need it. This is my analogy. Would you ever find an orthopedic surgeon that would do a total knee replacement and say, you know what? You don't need physical therapy. Just get the knee replacement. Don't worry about follow-up. Don't worry about rehab. You'll be all good. If you need anything, come back and see me for more surgery. I mean, that's what it's like. It's crazy.